Hello everyone. Today we will discuss about the TRALI. So what is TRALI? TRALI is the transfusion related acute lung injury, right? So whenever we transfuse any patient, we should be aware of this condition, that is TRALI, because it is the most common cause of the transfusion associated fatality, right? And it most commonly occurs after the plasma rich blood component. So whenever we transfuse with the plasma rich blood component, we should be careful about this entity, that is TRALI, right? So how the patient present to the us? Patient present to the us with the ARDS picture, right? So what is ARDS picture? Patient will be having hypoxia. After the blood transfusion, patient will develop the hypoxia. Patient may have the fever. Patient may have the hypotension. Patient may have hypotension related tachycardia, right? So patient usually present with the hypoxia, and after usually within the 4 to 6 hours, although it can occur up to 72 hours also, but main thing usually it occurs within the 4 to 6 hours. Just we have to keep this in our mind, right? And how this ARDS or how this TRALI occur? TRALI occurs due to the anti-HLA antibody present in the donor blood, right? So whenever anti-HLA antibody present in the donor blood, it will react with the leukocyte of the recipient, right? So it will react with the leukocyte of the recipient, and these leukocyte will aggregate in the lung fields of the recipient, and their inflammatory mediator will release, and that will lead to the increase in the permeability of the vasculature of the pulmonary vasculature, and that will lead to the edema here, pulmonary edema, and that edema is the non-cardiogenic, right? As we already aware that the ARDS edema is non-cardiogenic, there is no involvement of the left atrium. Here also same. So non-cardiogenic edema will occur. So let me rub this. So here we can see in this picture chest X-ray. Here before blood transfusion, the lung fields are relatively clear in this patient, but after the blood transfusion, within 6 hours, we can say there is very fluffy shadows, bilateral infiltrates are there. This is due to the, we can suspect this patient with the TRALI picture, because we have transfused the plasma rich component to this patient, and patient develop hypoxia within the 6 hours. So we can suspect that this patient may have TRALI. There is another differentials also. Patient general condition may lead to hypoxia. Patient may have some infection also. Patient can have fluid overload condition also, that is called as TACO condition, that is most common differential of this TRALI. But there the patient in the TACO, patient will have the fluid overload, so patient will develop the systolic hypertension, right? So we can differentiate by this also. So patient will present with this chest X-ray having the bilateral lung infiltrates, and patient will develop the hypoxia usually within the 4 to 6 hours. And the main pathogenesis, or we can say the main etiopathogenesis, is due to the presence of anti-HLA antibody in the donor plasma, although other non-HLA associated cause are also found to be related to the TRALI, but mainly it occurs due to the anti-HLA antibody, right? So how will we treat this patient, we will just stop the just treatment is just supportive only. We will stop the transfusion immediately, and whenever we suspect the TRALI, and we will correct the hypoxia of the patient, that is we will give the oxygen support to the patient, and we will give the anti-inflammatory, right, we will give the steroid to the patient. So one thing is that I say initially already that it is mainly related to the plasma rich platelet rich plasma. It can also associated with the fresh frozen plasma, whole blood, or the packed RBC also, but mainly leads to the mainly caused by the uh, platelet rich plasma. Okay, so uh, uh, lastly, just you should keep in mind that after the transfusion, whenever any patient will have the hypoxia, we should differentiate it from the fluid overload condition, that is TACO condition, that is transfusion associated circulatory overload, and also various recipient factors also that can precipitate to this TRALI. These factors include the uh, recipient factors. Recipient factors include like the chronic alcoholic patient, chronic smoker patient is already having some fluid overload, that patient is already compromised, having hypoxia. So we should be little more careful in these type of patient is surgical patient is on mechanical ventilation. So just please be aware of this fact, and this I have covered from the Harrison, and some general points here and there. So just be careful and study this. Thank you. And this is the last quote of the day, that the best way to predict your future is just to create it. We all are in the learning phase. Some are कुछ लोग हमसे आगे हैं, कुछ लोग हमसे पीछे हैं, but we will all are learning. So learn, create, and all the best to all of you. Thank you.